You are listening to the Lab Lowdown.
Hey guys, you are now listening to the Lab Lowdown. I think it's our third episode of 2018.
Second.
Oh, it's our second episode. Although we miss Sarah, who is one of our co-hosts, we have Fergus here today.
Hi.
And then Ashley.
Hey guys, welcome back to Lab Lowdown.
Yes.
P.S. We miss you, Sarah.
Yes. So this is one thing that is really important to us just as a laboratory because it plays a huge part into what we're doing. Today we're going to be discussing MACRA and MIPS and the programs and the explanations behind them. And this is also really good for you, Ashley, because Ashley plans to be an MD one day.
Yes, hopefully. So keep praying and hoping for me, guys. Cross your fingers.
Cross your toes.
One day.
Everything. So let's just start out with a basis of what everything is. So what is MACRA? So MACRA is the Medicare Access and CHIP Reauthorization Act. MACRA replaces the current Medicare reimbursement schedule with the new Pay for Performance program that's focused on quality, value, and accountability. The Center for Medicare and Medicaid Services, or as we say, the CMS, stated that MACRA enacts a new payment framework that rewards healthcare providers for giving better care instead of more service. So the quality of care should increase versus just, you do this, we'll send you here, you do this, you do this. So instead of actually just passing them through the system, they will get better care from all types of physicians, which I think is really important.
Exactly. I think this reminds all providers to really look at the patients wholly and to remind them quality is what matters most when they're treating these patients.
Exactly.
And this should help them when they practice medicine.
Exactly.
Definitely. Yeah.
I think I think a lot of people that I know, and I know that we have the mindset of it, is that, physicians are one of the expert, one of the members of the population that have expert knowledge. So we go to them and we kind of take their word for everything. So now that we see them as an expert and also getting that quality, I think it'll really just revolutionize medicine as far as getting excellent patient care. President Obama signed this into law on April 16th of 2015. It passed with a 392 to 37 vote in the House and a 92 to 8 vote in the Senate. The bipartisanship indicates that the legislative support for MACRA and the significance of the bill in the U.S. healthcare reform. So as far as the Affordable Care Act, that was a little bit more controversial on both sides and in, just this society and the political climate, but I don't think MACRA and MIPS had any type of upheaval like the Affordable Care Act did. So now that we've covered MACRA, what is MIPS? Does anyone have an idea of what MIPS is?
I think it just describes more of the P4P, so the performance review of these providers. But that's the main thing that I know about it. I don't know too much of the details.
Well, now you're gonna learn. So MIPS is the name of a new program that will determine Medicare payment adjustments and is an acronym for Merit-Based Incentive Payment System. So basically, it's a way for Medicare, the Medicare authority to kind of dictate and determine how each specific physician is going to be paid. Using a composite performance score, eligible professionals may receive a payment bonus, a payment penalty, or no payment adjustment. So it's really good for the physicians that practice quality care. They, it's not that physicians don't care about their patients. It's just that sometimes running a practice is so hard as it is that, giving 100% quality care isn't always the easiest thing. So they can receive a payment bonus for patient outcomes and how well their patients are doing, a payment penalty if they're doing, horrible quality care, their patient results are, not great, their patients aren't getting better, they're actually getting worse, and it's one of those things that the doctors do have control over. Or no payment adjustment, which can be good, bad, or otherwise. depending on the physician and how they run their office. So the composite performance score is based on 4 performance categories. So quality, use of resources, clinical practice improvement activities, which I think is my favorite thing. Sometimes when I go see my physician, it's a little bit unorganized. It's definitely not optimal for an efficient environment. Still using paper charts seems a little outlandish in 2018, but some of those practices really still haven't jumped on the technology bandwagon. So this will push them towards that, especially if they have a high Medicaid population. And then meaningful use of certified electronic healthcare technology. So it is something that actually will push them into using an EMR, but they should be using the EMR to improve patient care and practice efficiency.
Got it. I do have a question with this kind of merit-based incentive payment system. Do the patients get a say? Like, do they have surveys to give to the patients for each doctor? Or is it solely based on the records the doctor and the office keeps?
So a lot of it is based on the outcome of the patients and their patients' testing. Okay. So that's one of the reasons that we're creating a compliance panel, which we'll have podcasts about in the future. But, it's making sure that the doctor is accurately keeping the patient on track. I know one of the big factors is and it's, widely used to describe what MIPS and MACRA is. So say you're an internal medicine physician and you're treating a patient for a high HbA1c, you're giving them the correct medication, you're recommending all the dietary and lifestyle changes, but they're not getting better, and their HbA1c is just getting worse as time goes on. It will that will play into the score because you are, one, may not be effectively communicating it to your patient, you're not spending enough time with them, you're not giving the effective resources, things like that. And then they're also, not compliant with their medication, you're not necessarily testing them for the medications that they should be on, in the amount of time that they should be tested. I think over-testing is a really big concern, but when MIPS and MACRA really come into play, it's the fact that, you're testing because you want to make sure your patient is healthy in the most efficient way possible. And I think testing and using laboratory tests is a huge part of that because that gives you a real clinical, absolute view of what is going on inside your patient.
Exactly.
So that is, that's kind of a common example that's given, actually, that if your patient's not getting better, their health is declining, you can be penalized for that. Even though some people say you may not have control over your patients, you're their physician, so you are there to kind of guide them on the right track to optimal health.
Exactly. That makes sense.
It definitely makes sense, yeah.
I just know there's some scenarios where the patients, their results show that they're getting healthy, but they don't feel it. But that comes into play with so many things like depression or anxiety and stuff like that. So that also works with the patient's health. But obviously, the doctor has all those notes and should be taking it and putting those within the records for the patient.
Exactly. And what we'll cover the next episode on MIPS and MACRA is actually what the physicians and the physician offices are having to report on. Just because they're not going to be reporting on everything. I know they're starting to collect information on their patients kind of minimally right now to CMS, but there are specific measures as to how the physicians are graded on this.
Sounds good.
And I think it will evolve over time, of course. That's something that will, just because it is a new program and Medicare kind of reassesses things every year.
It's always a work in progress.
Yeah.
Yes.
And I'm just kind of thinking with our compliance panel, and I'm sure developments to the EHR systems, all that stuff, there's going to be a lot of new technologies that come out of this to meet that need. And it'll be interesting to see how that interacts into the commercial world with PPOs and whether or not they'll be, looking to utilize similar systems going down the line, because if the government's looking to save money, then private companies are too, I'm sure.
Exactly. I know for a lot of laboratories, they use the Medicare reimbursement as kind of a standard for what their fee schedule will be for the year. So it is a standard. They can definitely kind of charge more or less depending on demand and how they run their laboratory, but every laboratory is different. But I do know that Medicare is always a good marker as to what you'll pay or get reimbursed for that test.
Yeah.
Performance for MIPS will start on January 1st and will annually measure eligible providers in 4 performance categories to derive a MIPS score of 0 to 100. So the MIPS score can significantly impact a provider's Medicare reimbursement in each payment year, from going down 9% to getting a higher revenue of 27% or higher reimbursement, in this case, by 2022. So that right there kind of solidifies that the program is still in the works as far as, when this will officially roll out and kind of be implemented into healthcare in America. So the 4 performance categories are weighted like this. 50% is for quality, and we'll break this down next for the PQRS and the VBM. So that is an acronym that I think Ashley will review in a second. 25% for meaningful use, which we reviewed earlier. 15% for clinical practice improvement, so organizational efficiencies, better office methodologies, adapting to technology for those technology non-adapters, and 10% for resource use. So using the resources that are available to you in your area and things that are given to you by the government and all those medical resources out there. So the points provided for each category will shift over time to place an increasing focus on more resource use.
And then while we're on it, just because I can see it up there, the 50% for quality, that abbreviation for PQRS over VBM stands for Physician Quality Reporting System over the Value-Based Payment Modifier, which are the 2 things that MACRA combines. And so we can see that's calculated to help with understanding the quality of patient care.
Beautiful.
So this next section is probably the section that if you're a doctor out there and you're worried about your reimbursements, that you may well be skipping to. So this is how you can prepare for a higher payment bonus. So the first tip is to keep track of it. In order to maximize your Medicare bonuses over the long term, keep track of all MIPS requirements and other components of the MACRA legislation. So the CMS will likely update requirements on an annual basis, so keeping up to date, and I think we're going to try and keep people up to date via this podcast, via our website, can help you make sure that you meet and surpass all requirements each year. So secondly, prepare for the CPIA, which is the clinical practice improvement activities that we talked about earlier. So in addition to the existing quality programs, MIPS includes additional category for clinical practice improvement. So these can be anything from expanded practice access to population management, how many patients are you getting through the door and effectively treating every day, care coordination, beneficiary engagement, patient safety and practice assessment, and participation in an alternative payment model, APM, which is basically the pay for performance that we discussed a little earlier on. So if you keep track of and manage those subcategories, chances are you'll be able to earn a higher payment bonus through MIPS. So staying on top of the upcoming MIPS rules gives you as much time as possible to boost your MIPS score and thereby maximize the reimbursements. So the bottom line is you can earn up to 27% more in your Medicare payments or lose up to 9%, which is a significant amount of money for any practice.
Yeah.
So by 2022, your MIPS score can significantly impact your Medicare reimbursements. With some advanced planning, it's possible to leverage your existing efforts and start investing in resources to help maximize your MIPS score over the long term. So we're really looking at this as like a 4 to a 5 year kind of plan.
Exactly. One of the best resources will be our compliance panel, because it will help the physicians accurately understand what their patients are doing. Are you taking your medication? Are you using the dietary restrictions that we put on you, or the dietary changes, those lifestyle changes? A lot of people think of a prescription as like the fix it, but when a doctor tells you that you need to change your lifestyle or your health is just going to keep going downwards, then that's also a prescription, I would say.
Yeah.
It's not just a suggestion. It's like you need to change
Absolutely.
your lifestyle.
So if you're a physician and you're treating someone for bronchitis or, you know, lung cancer or something along those lines, and, you know, there's no evidence of them getting better despite you, you know, going through all the necessary steps, and your patient is seen to still be smoking, you know, 20 cigarettes a day and isn't taking their tobacco cessation medication, it's you know, it's not really, it's hard for you as the provider to show that you've made an improvement there, even if you're doing, you know, the counseling, the medication, all that stuff. So if you can demonstrate that to the CMS, then I think it would be hard for them to penalize you in any way.
What is pay for performance? So this is a closer look at the next step for quality programs, just because if we're going to ensure quality and enforce quality, we got to define quality. Pay for performance is not a new catchphrase in the healthcare community, but it is one that has seen a recent spike in interest from the general public and healthcare world alike. Maybe it's something that they kind of can track on Google and Twitter with all the hashtags and things like that, because people are starting to tweet and get more involved in healthcare via social media. So the renewed interest is due to the Affordable Care Act, or commonly known as Obamacare, and initiatives within the act that require hospitals and providers who participate in Medicare to engage in pay for reporting activities that will transition to pay for performance over the course of the next 3 to 4 years. So while the Affordable Care Act initiated programs are applicable to Medicare, major payers are also catching the pay for performance bug and will likely institute similar programs at the private level. So Fergus, you mentioned that earlier, that this, you know, a lot of things are taken from Medicare or used as a baseline for their reimbursement. So pay for performance is something that we'll probably see with commercial insurance.
Makes a lot of sense.
Later on in the year.
All right, guys. So what is the pay for performance, also known as P4P? The pay for performance encompasses the idea that providers should be paid for medical services based on the quality of the service that they provide, and it incorporates the measurement points including patient engagement, patient satisfaction, care coordination, and also health outcomes. And the theory is that by basing payment to providers on quality of service, patients will get better care and health outcomes will improve over time. And just as a reminder, this MACRA is just kind of helping Medicare improve rewards for providers based off of value of quality over volume.
And just adding on to that, there are 2 major federal programs that incorporate the pay for reporting and pay for performance as of right now. And those are the Physician Quality Reporting System and the Affordable Care Act initiated Value-Based Modifier Program, or VBM. Remains to be seen if the VBM is going to be repealed alongside the rest of the ACA, as the current administration sort of keeps enacting its agenda. But PQRS has been in place for several years as a pay-for-reporting program, where providers can earn incentive payments by reporting certain measures without thresholds to CMS. Beginning in 2013, PQRS reporting became mandatory for physicians, or they'll be subject to penalties. Okay, so in summary, the costs associated with healthcare are continuing to rise, and has been met by an adaptation in the way reimbursement structures are developed, especially as the baby boomer generation gets older and starts to qualify for Medicare. Managing the health of patients so as to control healthcare spending is going to become even more important. And while pay for performance may not be the golden ticket to improving healthcare, we certainly cannot say that the system we currently have in place is working perfectly either. Okay, well, on that note, everyone, and we will be returning to MIPS and MACRA throughout the next couple of years on the podcast and keeping everyone updated. But I think for today, that's about it. Thanks for listening. I'm Fergus.
This is Haley.
And this is Ashley. And if you guys have any questions when you listen to this, feel free to reach us at marketing@nwlabpartners.com.
And that has been your introduction to MIPS and MACRA.